cough, fever, sore throat. When a possible infection strikes, we turn to our family doctors. But every visit brings a challenge. How to give antibiotics quickly and accurately. Sometimes a single test can provide the answer.
My name is Rogier. I'm a family physician from the Netherlands. I've been working in practice since the last 25 years. During this time, I also did a lot of research work, particularly in the field of respiratory tract infections and also dealing with the problem of antimicrobial resistance and how to find solutions for that. Antimicrobial resistance occurs when microorganisms find a way to protect themselves against antibiotics. So it's like they turn on a different coat as a bacteria, for example, and antibiotics have problem recognizing this new coat, so they cannot kill those bacteria. It really gets scary because if there are so many drug-resistant antimicrobial agents or bacteria, the number of available antibiotics gets lower and lower until we find bacteria which cannot be killed by any antibiotic anymore. It's not a future problem, it's already occurring because the higher the volume of antibiotics, the more antimicrobial resistance. So we need to be careful, give patients antibiotics when they really need it because it's a great solution. But we should also not forget not to give antibiotics to patients who don't need it. They are potentially very harmful because you can also get very serious adverse events when using an antibiotic. So you get all kinds of irritating adverse events like bowel problems or allergy of the skin. But the biggest problem is the fact that your bacteria causing your infection are not vulnerable for those antibiotics. So it could be that you end up in a hospital and the doctors don't know how to treat you anymore because of multi-resistant microorganisms. So patients often think, but I have an infection, I feel really unwell, why don't you give an antibiotic? Well, there are more reasons for that, but one important one is the fact that for viral infections, like having the flu, antibiotics do not work. They only work for bacterial infections. Minor infections caused by a bacteria are still cured by themselves, so you can handle that. So it's more important to differentiate severely ill patients from non-severely ill patients. And this is quite hard. So doctors have a diagnostic uncertainty, which is called like that. That means that it's not always easy to find the right patient to give the antibiotic. And we know from many research papers, including the papers I've written myself, around 80% of all the patients, 80% of antibiotics used in primary care, they are not needed. So we should help doctors and patients in primary care to reduce all those unneeded antibiotics, which already will help reducing the problem of antimicrobial resistance. So when I started working in general practice and I used my stethoscope, for example, this little thing, you have them in all kinds of sizes, I found out it was really hard to diagnose pneumonia. And this is not only me, but it's often quite hard for doctors to admit. So I tried to find out in a big research program to see which elements of the consultation and the communication with the patient help the doctor most to find the pneumonia patient. So we did this and then we concluded there was really only one test which turned out to be absolutely the best to diagnose pneumonia better. And this is called the C-reactive protein test. It's a protein found in your blood which shows that you have a kind of infection or inflammation. And if the test result is very low, then we are absolutely sure that nothing serious is going on. And it turned out when we did this research that CRP test was even much stronger than anything else a doctor did in his consultation room with the patient. So this was really powerful. And then we looked at the antimicrobial antibiotic prescription rate, and we found that even in the Netherlands we could reduce those number of unneeded antibiotic prescriptions by almost 40%. So we need to conclude that you have quite serious complaints. I'm not sure what's going on. I think it's important to do a CRP test that measures your inflammation. So when the result is very high, you need to have an antibiotic, because then you have probably a pneumonia. If the result is low, you can just go home and take some rest. And this is really so powerful for the patient, not having to go to the laboratory or to a hospital, and just staying in primary care and feeling helped by this doctor with this new test. And those patients were very satisfied. So despite the fact that normally they would come for an antibiotic and are only happy going out with an antibiotic, this time they were even more satisfied that the doctor could tell them it was not needed to use it. So we see that in the Netherlands, all doctors, almost all GPs in the Netherlands use this test now routinely during daytime, but also when they have shifts at night or in the weekends. So I'm a happy doctor because I found out that we could really change the way we handle patients with acute cough in a different way, in a much better way. Let us use less unneeded antibiotics to create a better world by reducing the global problem of antimicrobial resistance. Let's do it.